Good afternoon. Good morning. My name is John Carroll. I'm the CEO and founder of the Service Council, and welcome to today's in-service podcast event. Um, really, an interesting set of events that we've been building across the in-service podcast series to welcome service leaders, customer support leaders on the industry side, but also the technology community who's also helping to automate customer experience. And we toggle back and forth between those two communities that we support. It's a series that's been building for the last year and a half now. So we've had many episodes that I think are noteworthy and a great value to our community to learn from. And there are so many to reflect on positively that I say, wow, that was really profound and that really hit home. And gosh, that's going to be a great resource for our community and our membership. And then there's today's session. And today's session is one of those things that I think I'll look back at the end of my career and say, wow, that really made me proud to bring this discussion to the table, because of the importance, because of the depth, because of the weight of the topic. And so I am incredibly pleased to be joined today to talk about the patient experience, learning moments from a personal health journey. And I'm joined today by advisory board member of the Service Council, longtime friend, contributor, Linda Tucci. Linda is the Senior Global Director of Technical Solutions Center for QuidelOrtho, which is a new merger that came together.
Mhm.
And Bob Downey. Bob Downey is Linda's former colleague, still friend and confidant. Bob is the medical team coordinator for global health teams. And they are both sharing a personal journey right now in health, having both recently been diagnosed with cancer. And so I'm going to pause there. Today's episode will be available on all the different podcast channels you subscribe to. You can also access it, at the Service Council's website. And I'm going to ask both Linda and Bob to introduce themselves. So why don't we start ladies first?
Mhm.
And if you could just introduce yourself personally, professionally, and a little bit about your personal health journey that you're going through.
Thanks. I'm Linda Tucci. So currently, as John said, I'm the global director of the Technical Solutions Center at QuidelOrtho. And earlier this year, QuidelOrtho came together, uniting two really great in vitro diagnostic companies. I'd been with the Legacy Ortho organization a little over 6 years, and my team is focused on remote technical support to our customers. And they're the medical technologists that run instruments in the clinical labs. And our job is really to keep our customers up and running so that they can care for their patients. I started my career as a med tech, very proud to have done so. I really believe it's such an unsung hero position within healthcare. Past 20 years, I've been in service and support leadership roles in multiple medical device companies. Too many to say, but I'm just a service guy through and through. I love what I do. I love solving problems. I love my people, and I love our customers. My diagnosis of breast cancer was at the end of this past June, and I did start chemo in August, and it's been quite a journey, but we'll dig into that. Happy to be here.
Outstanding. Welcome, Linda. Thank you very much. And Bob, an introduction to yourself.
Thanks, John. It's great to be here. So, like Linda, my background is in clinical laboratory science and the medical diagnostics industry. I graduated from Santa Clara University and I transitioned from working in the clinical lab to working in medical diagnostics. I've worked for both Abbott Laboratories and the diagnostics division, as well as Sysmex America. That's where Linda and I became colleagues. And I've been in a variety of roles, primarily in field based application support, but I've also worked in quality and regulatory and doing in house technical support and training. I love clinical laboratory science. It's I hate to say it, but I think it's a calling. I really, really do enjoy it very, very much, and it brings me great joy. One of the things that I also brings me great joy is my work in Haiti. Since 2004, I've worked with global health teams supporting clinics, labs, and hospitals as part of humanitarian work that I do. And in 2020, I retired from Sysmex and began devoting pretty much now full time all of my time to working in Haiti. supporting the clinics there, and then also working with Hospital St. Damien, which is the largest children's hospital in Haiti, as well as Hospital St. Luke, doing laboratory improvement projects, staff training, informatics, grant writing, and helping with lab management. And that brings me amazing joy. And it's a great way to use my industry experience, but also use my clinical lab experience to help other people have better, healthier lives. In May, shortly before Linda, May 2022, I was diagnosed with very aggressive metastatic prostate cancer. And I started treatment later that month. So my first chemo was the beginning of July, and I'll be starting radiation therapy later in the fall. And I live in San Diego, and I'm a patient at a very, very large health maintenance organization.
Thank you so much for joining, Bob. Thank you so much, Linda, for also joining. And I want to encourage our audience to continue to comment and react to the discussion, and to use this as a platform for discussion as we go. All the amazing supportive comments we love to see. So thank you very much for all the positivity and warm thoughts here. Really. The whole community is behind the both of you as you navigate things and continue to go on the up and up in terms of health. So, but I love your comment, Bob, about the joy that you find in all the things that you're doing on the personal side in Haiti and other areas of the world. Service is humanity. We talk about that all the time as an organization. In fact, we give out an annual award at our Smarter Services Symposium called the Services Humanity Award. So I love that. It speaks dearly to some of the things that we're passionate about. So completely humbled that you've chosen our podcast series to share your personal health journey. And personally speaking, I'm just touched. So thank you to both of you. The cancer journey is a personal one, and we talk about the importance of personalization as it pertains to customer experience. That's one of the things that we look at in terms of trending. And customers, they want service, they want it their way, and this drives behavior at the customer level in terms of what channels do they drive their service activities through, what demands do they place on providers, and many other aspects. Can you talk to us about the varying personal preferences you have as a customer in your patient journey, and where perhaps you encountered some missteps? Linda, why don't we start on your side?
For me, the biggest challenge had been, right at the beginning, right, which is overwhelming when you're given such a diagnosis. And that's really an area that I really thought a lot about. I mean, I had a biopsy the end of June on a Thursday. My radiation oncologist was amazing. She was very clear, looked me in the eye, and she said, "I'm telling you, I'm very concerned. I'll try to fast track your results." Called me Friday evening, told me I had invasive ductal carcinoma that was high nuclear grade with necrosis, and I knew enough to know that was not good, right? And I knew that I needed the 3 markers, having breast cancer. I know what I didn't want, which was triple negative breast cancer, and you get apps, right? Because that's how you communicate with people now, is through apps. And in the following week, I got my app notice, 1 negative, 2 negative, 3 negative. I'm staring at the app going, somebody's going to call me, aren't they? You know what I mean? Like deer in the headlights. I have triple negative breast cancer, which is rare, aggressive, and oh my, oh my, oh my. And it was really hard for me, extremely hard. And so that pre-connection of how you start that relationship off, what I would say is that better understanding what communication early on would look like. I had to wait until you had, and this is and Bob can tell me if he feels the same way, until you have a plan and you've connected with the team, it's torture. Right? It's the unknown. And even if I had early on maybe met with my nurse navigator or social worker to explain and dissect what would be happening, that would have been beneficial for me, and to get my homework, because when I did have the meeting, I met everybody, and here's your reading, and here's this. I was overwhelmed. You know how you have to go through your what is it, the Kubler-Ross curve, anger, denial, bargaining, accepting. I'm right in that wave, and it was overwhelming, because what happens in the customer experience, it's about building that relationship. And I really felt at times at that point that I was alone, and that lack of human touch was a problem for me. Does that make sense?
It makes perfect sense. Yeah, absolutely. Bob, do you have any thoughts to share to build on that?
No, absolutely. That we've not having talked about that specifically. Linda and I had a very, very similar experience. You know, we talk about personalizing the customer experience and giving customers tools that work for them. And with me, my experience was exactly the opposite. You know, we talk about personalization, but during this whole process, I felt like I was being processed through a factory. I was more of another guy with prostate cancer, um, just being processed. And I found that the vast majority of physicians and staff, they treat this as, oh, it's just another guy with prostate cancer, got to crank him through. And it's not that way for the person that gets that diagnosis.
Mm-hmm.
It's I know we have many people in the audience, I'm sure, who've had personal cancer experiences, or those who are close to them that have had that. It's a terrifying thing, and it really, really messes with your head. And the last thing you need is to feel like you're just another case being processed. Um, I think there's so many amazing things that healthcare organizations have done to make things easier, like the app Linda talked about. You know, you can refill your prescription on your phone, you can get your results. And I think informatics and automation have made the practice of medicine easier, but I think that healthcare systems really need to take a pause, and they need to look at efficiency versus compassion.
Mm-hmm.
You know, electronic systems have made it so easy. You can go into Epic, and I've used Epic as a user on the customer clinician side. It's so easy to go in and check boxes. You know, oh, I'm going to do this order set. I'm going to complete this. I'm going to send these results. But I think in certain cases, that's awesome. But I think in other cases, the patient can really suffer with that. Um, I had a similar experience to Linda. You know, my urologist, once I got my MRI results, he let me know about my metastatic cancer, which was likely very aggressive, in a patient portal email. Just like I got an appointment reminder, I have to refill my prescription.
Mm-hmm.
And you know, yes, he leveraged the electronic medical record. Yes, he leveraged the patient portal to practice more efficiently, but that crushed me. I'm a really strong person, and I have a clinical background, and I have an amazing social network that surrounded me during a really, really dark time. But that crushed me, getting that information in a blind email. And then it took me all day to get a hold of him. And you know, my background in Haiti, I work with people who are medically underserved, who they don't understand medicine. They have language barriers. There's so many barriers to care. And I always think about the person that doesn't have my background, that can't advocate for
Mm-hmm.
themselves. How would they have navigated that?
Yep.
Getting a diagnosis like that via a patient portal email was devastating. And I think that health systems really need to look at provider utilization and efficiency, and you can't let provider utilization and efficiency overtake and take priority over compassionate care.
Mm-hmm.
And that was a
Well,
situation where that doctor should have picked up the phone and said, hey, I want to talk to you.
mm-hmm.
I
And
I couldn't agree more. Yeah, please
yeah,
continue. Yep.
you know, and that was some of the feedback that I had for them, because of course, you know, we want to give, as customers, we give feedback, right?
Yeah.
That was some of the feedback that I gave them after. I said, you have amazing tools. You have a customized version of Epic that you can do a lot with. You know, use your informatics and get information about the patient, the customer, and what are their preferences for how they want to be communicated with. You know,
Mm-hmm.
maybe you have someone that has language barriers. Maybe you have somebody that has transportation difficulties. capture all that information up front. So when you're helping that patient navigate a situation, everybody who touches that patient is aware, hey, this person,
Mhm.
can't get to chemo. Hey, this person,
Yeah.
English is they don't speak English and they have a weak understanding of this language. Use your tools to help improve the patient experience. But in my case, no one ever asked those questions up front.
Mm.
Linda, do you have any comments or reactions to Bob's discussion so far?
Oh, totally, hands down. I mean, I told them you should put in my chart high maintenance and a control freak. It's important that you all know that because also too, I like to be educated.
Sure.
Like I have a port in my chest, and when they come at me, I'm like, whoa, whoa. Before anybody touches the button, I need to know what drugs, how quickly, what's the mechanism of action, the why. That's how I'm wired. I know it could potentially be annoying, but that's what I need as customer. And so to Bob's point, some people like to just get it over with, knowing personal preference. There's great value in that. And I feel the same way. I have sat in rooms and have cried over watching other people that I know are having so much harder of a time digesting it all. Um, so,
What you're bringing up, where I'm at a workshop here, and we were just talking about the different cognitive personalities that exist: left brain, right brain, four quadrants, analytical, relational, and all the different elements. And it's like you've got to think about who the person is on the other side and personalize it based on them, because you could be talking a completely different language than how they learn and how they consume
yeah.
and so there's so many considerations here. I want to put a comment here. Thank you for your courage today. Our audience is right behind you both. And thank you very much for choosing this platform for the discussion. And yet we're being critical of the patient experience. Sorry, we're going to do it because we want to improve it. And so
Yeah.
some of the ways that you just talked about it being broken are just heartbreaking. So
Can
yeah,
I add another comment, John?
yeah, of course.
And I think, and to echo what Bob said, these tools are wonderful. There's a place, there's a great, I mean, I love having this app and having my history and all the information and the beyond. So I want a balance, right?
Hmm.
And getting real-time information. That's great. What I think we have to recognize, and especially within healthcare system community, that because we have so much of this automated connection, virtual telehealth is wonderful. But when we're talking about, I'm going to say, more devastating diagnoses, such as cancer can bring,
Mm.
that now every human touch point you have, the value is exponentially greater.
Hmm.
So therefore, the how one trains and educates, and we touched upon this earlier, right? It becomes almost hypercritical that the healthcare system maximizes that. So that when I connect with you, and Bob, you were saying that whether it's the receptionist or the phlebotomist or then the doctor, that connection I have says, I see you, I care, I'm hearing you. And that's something that while I am very appreciative of the care I receive, there's not a consistency that I think is what I would be doing as a service leader within the healthcare system. Does that
Yeah,
make, you know what I mean?
I agree with that. And I think another complication of the time that Linda and I were both diagnosed is that healthcare, like many other industries, they are still reeling from COVID.
Mm,
And unfortunately, and I think this is true in many industries, not just healthcare. I
Hmm.
think during the time of COVID, because people had no choice, they had no option, they had to go and do virtual. They
yeah.
had to do phone. And I think what has happened is a lot of industries have realized, ooh, well, now we can still do this and we can save money.
Hmm.
And I think that there are times when you shouldn't do things virtually, you shouldn't do things over the phone. And that was another huge challenge for me. The only time I had an in person appointment was for my biopsy, which was I'll be honest, it was a terrifying experience. And I had never met the doctor in person before. And everything else was over the phone. And the total amount of time that I had for my education and receiving information about my diagnosis was 35 minutes over 3 phone calls for stage 4 aggressive cancer.
Mm,
And I needed that in-person FaceTime because, like Linda
mm,
said, you have a jillion questions, and it is like drinking from a fire hose.
mm,
And again, I can't imagine what it would have been like. It was hard enough for me and for my family. I can't imagine what it would be for like someone who they don't have the basics of like prostate cancer. They don't
mm,
understand what a lymph node is. I mean, I know
mm,
all those topics, but what
mm,
about those people who don't have it? I mean, that's when you really need to step back and say there are times that virtual is not okay. And
mhm,
you need, to have those in-person discussions. And again, I think it goes back to getting that information up front. How do you want to be communicated with? Because that was something I shared with my urologist when he dropped the bomb via email and I finally got him on the phone. He said, well, I have patients that prefer getting that information that way. I said, hey, that's great. I don't understand that, but good for them. But I said, the big thing is you never asked me. You
mm,
assumed and you
mm,
crushed me.
That's profound. That's profound. We're just getting comments galore here in support from many of our community members. How heartbreaking and how brave both of you are. I want to encourage our community to continue to send in the warm wishes and the wealth and the good
mm,
thoughts and all the good stuff here. And I would just want to respond to the discussion here. We hear this topic of robotic process automation. Goodness gracious, we need to steer that away from the patient experience in many cases. It's digital transformation initiatives it can't dehumanize the experience, right? And so I just wanted to comment in response to things. Let's move the discussion forward. We want to plug in on other aspects of your journey. And you two are kindred in many ways. The personal health journey that you share, the previous roles at Sysmex where you guys work together, and so what I'd like to do is just get your unique opinions on service strategy. One of the things that I was just at a workshop and talking about was how um, there was this element where we're taking this outside in approach and learning best practices from other industries. And the founder of Shake Shack was actually brought into a hospital to train them on customer experience. So that whole outside in approach,
mm,
and how you can learn from other industries. And at the Service Council, we talk about many best practices in service delivery, customer support, and just overall customer experience.
mm,
Some of the trends we were looking at are cost oriented, some are revenue, some are customer satisfaction oriented, and this balancing act between those three oftentimes adversarial forces. We just wrapped our symposium, and some of the trends that we're navigating right now are talent shortage and burnout, and some of the employee support methods in terms of effort, and how the challenges of delivering service are increasing. What can you both share some personal philosophies on service strategy and what you apply in the business world, and now some of the relatable learnings that you've had from your patient experience to that process and some of your points of view? Linda, could we start with you?
okay, top
Sorry.
of mind, over the years, my formula really hasn't changed very much. It's just been refined. I'm a people person. I'm relational. And I would say that for me, I have always believed that employee engagement is a key indicator of business success. And we're very clear, and we have been. And this has been every role of. I always start by saying, mutual trust is the ground rule for our team. And what does that really look like? And we have a multi-pronged approach because the challenge that we have, I'm going to say, over the past few years, and COVID just added fuel, is that we're in a greater complexity, the landscape, right? So you've got to take care of your people. Taking care of your people and driving employee engagement pre-COVID is not what it is now. We've got multiple factors, and we all know this, right? So we need to respond to that. I always tell people it's the quality of the conversation that we have with our people. It's not about time. It's about really making that connection. There's nothing more important than respecting and having a good dialogue with the person that you report to. I would say we really focus, being in a very regulated organization, and especially with what I'm focused on now, which is remote technical support, removing obstacles. Our processes still are very burdened. How do you do that? How do you make the job easier? And you have to really think out of the box in order to do that. Sometimes I'm very flippant and say, oh, we're so 80s in some of our approach. But actually, it's not far from the truth. Do you know what I mean? And so, how do you continue to remove obstacles and streamline your processes? And we talk a lot about technology. And for us, we've talked a lot. And I would say in the past 6 years, maybe we talked too much. I think we're making better decisions to say foundationally, what is the technology that will enable us and bring us forward? And to really have the courage to make tough decisions. What I think is important and critically important over time is that your service strategy has to be seamless, and you can't look at any one component in an entity itself. And I don't care about reporting lines. I've never cared about reporting lines. I'm a systems thinker by nature. And so I think every organization, whether that's healthcare in any industry, you look at holistically what's the experience you're trying to create for your customers, and you make that happen. I always tell people my focus is I focus on taking care of the people because they take care of their customers. But we have to enable all of that in order for that great customer experience. I would also say, specifically in medical device, the majority of our interactions still, to a high degree, and this is not true across the board, but in a lot of the big IVD companies, is over the phone. You have an instrument, you have a phone, you have an instrument that you can interact with to get results. We also have a generation that's grown up with the internet as a means of intimacy. And while I don't want to go so far as to jump into meta, and it's a little too far out for me, I think we have to think very creative around enabling customer self-service and provide more options. I know I'm bouncing around a lot, but I think right now, to go back to what I started with, the complexity has expanded. I think when we start talking about these different components, we have to break it down. On the people piece, we not only have that burnout and mental health and other challenges and turnover and quiet quitting and, different perspectives, but did you see Bob's face light up when he talked about his job? This is a person who knows his purpose, right? So we've got to say, how do we spark that passion, right? And there's more we could say there. And I also think the external vendors have to kick it up a notch. Do you know what I mean? Help us solve our problems. Do you know what I mean? Help us figure it out. And maybe because I'm feeling needy. So, but I'll say my experience has only re-emphasized, I believe, my core perspective of how I'm looking at taking care of the people, to take care of the customer, and lay down that foundation that will enable success for that. I'm bouncing around.
No, you're doing
Bob,
great.
what do you think?
You're doing great.
No, and one of the things you said is about the seamless customer experience. And I think one of the things that is really important for me, and I can relate this to my experience as a patient, is making sure that the customer team, the sales team, the care team, the service team, everybody knows what everyone's roles are and what the customer is looking to accomplish. And I think having that communication with the customer is really important, and it's going to vary depending on the kind of project that you're working on. I think when you talk about Shake Shack, and the customer experience, one of the things that I've seen is that at different levels, the way my health system engaged with me as a patient really was extremely variable. The receptionists were great. Yes, you got put into the room right at 1:00. But when it came to the experience with the doctors, it was almost kind of like, well, that doesn't really apply. That customer experience thing doesn't really apply to me because I'm a doctor. But I think the seamless customer experience is really important, and it should be all touch points that have to be concerned about the patient experience and the customer experience. Linda talked about communication styles and generational divides. I think that that's really important because a younger person, they might want to get information about their diagnosis or whatever via text message. An older person, may not want that. I mean, I think that health systems, just like those of us in the diagnostics industry and other industries, service industries, we need to consider different learning and different communication styles depending on the generation and the background of the client or the patient.
Mm.
First of all, Linda, I want to bring back some elements of the 80s, just as a quick point. You talked about the 80s. There are some elements of life and business that are timeless, right? Being sensitive and professional and human-centric, it is a timeless, it's not going away, right? And all these process and technology automation initiatives, at the end of the day, they are optimizing people, right? So let's not forget about the digital transformation journeys, that seamless customer experience. It's all about people augmentation, right? So that's I just wanted to build off of that. Do you have a comment or a point you want to make?
Yes.
Linda?
So
Or Bob?
I think, I think one of the things about this, and one of my favorite quotes from one of my former mentors was, you can't just fix the instrument, you have to fix the customer. And I think that when you consider holistically, you consider your customer, it's not just fixing the analyzer that's broken. It's not just making sure, customer service didn't get the order to the customer and now they're out of reagent. It's considering the customer holistically. And I think that in my situation, and Linda, I'm sure you would echo this, had the whole patient been considered holistically, that really would have improved my outcome and my experience. And I think in general, when you consider the patient holistically and all of the things that they're having to deal with, that's going to lead to better outcomes, which is better for the patient and it's better for the health system because it's going to drive costs down.
Agreed.
Yeah. We had a comment. We continue to receive comments coming in. This one about a personal experience where a doctor is leaving the profession because of the younger demographic not feeling the need to come in and have that human to human connection, and that it doesn't align with the Hippocratic oath that doctors take when they become a doctor. So thank you for sharing that personal experience, Marion. Appreciate that.
Yeah, wow, that's hard to hear. I will say just like I'm on the East Coast and in a rural area, and my healthcare system is in a rural community, and like I would say my surgeon's great, my oncologist is great, my radiation oncologist is great, and so there's elements of, I think I have found a much more, I'm going to say, caring community. Do I still have feedback? Well, everybody knows me. Of course I'm going to have feedback. But the reality is I have had I'm very happy to be where I am and being served by my med team because they're fabulous. I just think it's interesting, as Bob said, at the polar opposite when we talk about healthcare systems as well. I just highlight that.
I think also too, I'm in a much better place now. I love my medical oncologist. I love my radiation oncologist, but their background is more medicine. My challenge was dealing with the surgeons. And I think that's when we talk about communication styles, when you're interacting with different kinds of people, I think surgeons versus physicians and their mindset is really can be a challenge. Surgeons are very task oriented. Do the mastectomy, take out the prostate, fix the hernia. They're very, very task oriented. Whereas physicians, I have found that my radiation oncologist and my medical oncologist, they took time. I mean, one of my most touching moments was when I first met my radiation oncologist, and he sat down in front of me and He introduced himself. He pushed the computer cart out of the way, and
Mm.
he looked at me very calmly and quietly, and he said, "What do you know about your cancer?"
Mm.
And he just sat there. And I almost started to cry. I mean, it was very, very overwhelming because no one had ever done that. No one
Mm.
ever stopped. And again, I think it's a communication style between
Yeah.
physicians and surgeons. And again,
Mhm.
that's just again considering how you communicate with people, and
Yeah.
it is very important.
I'm going to try not to cry over the course of the remaining part of our podcast.
Mhm.
So I'm
Mhm.
going to try. I'm not going to promise. And Linda, we know and love you because of your vocal nature. So continue. So let's go to the state of talent in the healthcare industry. So do you feel there's a shortage of skilled professionals in the healthcare space? What are your viewpoints on that?
Oh, yeah, uh-huh.
Yes.
Uh-huh.
Yeah.
Well, but it's also true, right? It's the complexity of, I forgot who first said it, but for years, the silvered hair tsunami, right, with
Yeah.
the Great
Yeah.
Resignation,
Yep.
and then talent pool is not there, and hey, listen, at least in our organization, where hey, you want to come work for an organization where customers are going to complain all day long,
Yeah.
and you can work overnights and weekends and overtime, and it's and clearly I'm being a little facetious, but also too, people are looking more reflective on what they want to do. Now, I think service people are just inherently special.
Yeah.
I'll say that, and Bob actually alluded to vocation. I actually feel that in my role, in my calling, is somewhat of a vocation as well. But we are at a critical place, and that's why what I also said, it's not just about. I think we've got to tap into different talent pools.
Yeah.
I know we're not doing enough in that regard. And
Hmm.
then also too, if we really focus on technology that makes the job easier and we can like drive customer self-serve, it's not going to be a one size fits all approach. It needs to be looking at it from different areas. That's why I really have a great appreciation of the Service Council and the work that we've done, and having the privilege to sit on the advisory council. Because when you start having conversations with individuals from different slices of industry, you may have the same challenge. And yes, you do. But because you're looking at it from a different lens, it's almost akin to like the Medici effect, right?
Yeah.
You're
Yeah.
looking at it from different lenses, and there's that spark of creativity that may have happened if you had not maybe engaged with people looking at it from different views. But I do say, Houston, we do have a problem. We do
Yeah.
have a talent shortage across the board.
Yeah, Bob, could we build off of that shortage issue with maybe one of the biggest causal factors, which is mental health and burnout and the rigorous nature of the day-to-day job, right? It's a tough profession.
Yeah,
What are you?
and I think that we already health systems were stressed. All everyone was trying to do more with less.
Mhm.
And then COVID hit, and so already you had people that were on the edge, and then you have all the uncertainties associated with COVID, and I think that stressed people out. I think it burned people out. I think it's driven people to say, "Hey, this is not the kind of life I want." And personally,
Mm.
I know a lot of people. My background is primarily the clinical lab industry, and I know so many CLSs around the country and technicians who basically said, "I'm out. This is not
Mm.
the kind of life that I want." And either they retired or they made career changes. Um, and I think that, when we talk about talent and training people, I'm very worried about that because
Mm.
we can train people on the technical aspects of the job. We can train them how to fix an analyzer. We can do just in time learning to make sure they have the tools. Oh, this is broken. This is how you fix it. But we can't train. We need to do that mentoring, going back to fixing the customer.
Yeah.
That's not something you can just do a just in time learning or a podcast for. You need to do something to mentor people so they understand how to fix the customer, so they
Mm.
understand how to have those difficult conversations with the customer that sometimes are necessary when you have to fix the customer. And I
Mm.
think that's a huge weakness. And that's something I'm very worried about because we've had so much brain drain with people
Mm-hmm.
quitting and people retiring. And
Mm-hmm.
now is the time more than ever when we need that institutional memory. We need those people who can have those difficult conversations. And a lot of those people are gone. I
Mm-hmm.
know an example, one of my, longtime customers had a huge cyber attack and they were suddenly thrust into a situation where they had to do everything manually. And there were so many people there that had never ever had to work in that kind of environment. And they had to actually see if they could get people come back out of retirement to help them navigate that because they just didn't have that, again, that institutional memory or that
Mm-hmm.
institutional experience on how to navigate those situations. So I'm worried about that knowledge transfer and that
Yeah.
mentorship piece on how not just fixing the problem, but more holistically fixing the customer and dealing with difficult situations.
Absolutely. Amen to that. Yeah. So according to the Voice of the Field Service Engineer Survey, which is a study conducted by the Service Council, 54% of technicians do not intend to be a technician for the duration of their career. And when you bake it down by generation, it's not just the retirement crisis. According to the Bureau of Labor Statistics, those executives that are over the age of 65, i.e., retirement, is going to double from now until the year 2060, from 50 to 95 million. So that's going to continue to go up and to the right. But the engagement crisis is even deeper. And you look at the demographic on the younger side. I think with Gen X and Gen Y, 65 and 67% of technicians are not committed to the career. And it's not like somewhere over the rainbow. It's, 40% of the time within the next 1 to 3 years. Right. So it's right upon us. The engagement crisis is so tough. And we had a really interesting and relevant comment from one of your former colleagues or current colleagues, I should say, taking care of our people so they can take care of our customers. So simple and so profound. Linda, you taught this gentleman, Wayne, that 25 years
Yeah.
ago. So,
Oh,
yeah.
Wayne. Yeah, that's beautiful. Well, that meant a lot to me. I welled up with tears. Do you know what I mean? This journey also has been such a beautiful echo for me personally, which I may start crying right now on. You don't realize how much you impact people in so much. And I have in even little ways. And while I've always known that to varying degrees, because of this experience and in areas that have hurt me, I am hypersensitive to how I live my life in a way that I want no one to pass my way in vain ever again. It's been very impactful. So Wayne, that meant a lot to me. But can I also say, as you guys were
Yeah.
talking, I came across because I think it's important for this conversation. I was looking, I think last week, I got an email. Gallup did they have their, I think, annual well-being survey, and just recently had done their one of their team members had written a book, which just came out. It's on my to-read list, called Blind Spot. And what's very interesting about it is that so they're equating well-being to happiness globally, and so what they're seeing is that the level of unhappiness, anger, stress, sadness, physical pain, is increasing and has reached a new global high. Well, that's not good, and the more telling piece is that unhappiness has been rising for a decade. So it's not just COVID, right?
Yeah.
So when you talk about mental health and, clearly we have a global issue at hand. I just bring that up because I had just read it.
Well, and I
It's great. Please, Bob, go.
and I think also too when we talk about mental health and burnout, as I've been reflecting on my experience, I wonder if there's probably a big element of burnout in some of the physicians I've dealt with. And
Mm,
I wonder if well, I know that that's definitely probably colored and influenced the interactions they have both with me and with other people. And I think, going back to, we have e-tools and it's so easy to click a box in Epic and send the order out or send the results out, that further depersonalizes things, because when you get burned out, you kind of depersonalize, you distance yourself. And I think that burnout definitely, it's a problem for workers, but it's also a problem for the customer interaction, because the customer knows when they're dealing with someone who's likely burned out and doesn't care.
Absolutely. Absolutely. Can we go to the customer journey side of things if we could? So, when we look at the critical phases of the journey, the service journey, there's the pre-event experience, there's the during the event, and then there's the post-event experience. As you sort of reflect on your personal journeys in the patient experience, what's most broken? What phase is like, wow, that's most broken? Linda, do you want to comment first?
Well, and probably because it's recent, to me, it's that pre-event. So if I echo, maybe what I've stated already, for me, it's the in any customer experience, the honeymoon period's great, but once you put a ring on it, right? So establishing that, I'm going to say that mutual negotiation of communication and interaction, and that, but what really has been a lack of personalization and silence and dropping bonds. So to me, that piece for me felt broken, right? So that I would say that pre-event, specific to undergoing, cancer treatment. I would say once we got the communication established, and I knew who to go to, and I know who to call, I've been comfortable in the interim. I still had lots of questions, right? But I would say that beginning part was probably the most anxiety-ridden, and it was just like the longest month of my life. I mean, Bob, what do you think?
Absolutely. That for me, my diagnosis, unfortunately, was dragged out for many, many months. And the waiting for me and my family, a lot of people don't know that it was dragged out for many months, but that waiting was just torturous for me. And I think also, too, never knowing who the captain of the ship was, not knowing who's my project manager. There was no one doctor, there was no one nurse navigator who said, "Hey, this is the plan. These are our goals. This is what's next." I never had that captain of the ship or project manager to help guide me on this very, very difficult and emotional place. It was pretty much, you have cancer, go figure it out. And for me, I'm okay with that. I'm very much like, I can survive on my own. I have a resource network that I can draw on. But again, I always think about, the person that doesn't have that. And I think that not having that project manager or nurse navigator could be devastating for some people. And again, I think it could lead to a worse outcome. And I had huge delays with my diagnosis, and I was able to say, no, I'm not going to wait a month for my CT scan. I'm not going to wait a month for my bone scan. But a lot of people don't speak up about that. And unless you have some kind of nurse navigator or someone who can advocate for those people who can't speak up, that was a huge, huge problem.
Yeah, and that's why the explanation, and I'll be honest with you, the first, not the first, I was really overwhelmed when I met with the pharmacist to go over the 6 months of my chemo. And my toughest drug was vitamin D. Do you know what I mean? Like, I didn't take anything. So just getting this wave of all of these drugs they're getting, here's the drugs you're going to get to prevent the side effects from the other drugs, and here's some more drugs in case you have side effects from the drugs. And I was just like, whoa, 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 whoa. And I know enough to even negotiate my steroid levels, or I can't manage 10 milligrams of dexamethasone. And so, with the background that Bob and I have, we clearly can advocate for ourselves, and it's very apparent to me, and which isn't mainstream unless you have that background. And that's why I also feel, I want to help people moving forward as they navigate, such a diagnosis. So I hope to do that as well.
So, go ahead, Bob, please.
I just want to echo something that Linda said. Just for me, that was really, really touching. It's just the outpouring of support that I received from so many people. It's been a very, very difficult journey, but my family, my friends, my coworkers, even former customers that I've had for over
Uh,
25 years, people that I haven't heard from 10 years, as soon as word got out in the laboratory community about my diagnosis, people were coming out of the woodwork, and it was really, really touching and overwhelming. Um,
yeah,
it's all about the relationships that you have with customers. And
yeah,
one of my dear customers, I have customers that I've become personal friends with, but then I have customers that I've known for a long time, and they're just good people. And one of them reached out and said, "You've always been here for us. We will be here for you." And that was
mm,
what I needed to hear. And so I'm
yeah.
just the outpouring of love and support from family, friends, coworkers, neighbors, customers has really helped me through a very, very difficult time.
Ditto. Yeah.
Amazing, amazing. Thanks for sharing that, Bob. Um, l- uh, let's move on to a topic that it doesn't even feel appropriate to go to after all this touching discussion here. But on the technology side of things, digital transformation. Boo! I know, Linda. I know. Um, the technologies that enable you in your journey. Can you just talk about that, like self-service portals and apps and
Yeah.
all these are they helping? Are there trends that you think the healthcare industry could draw from to enhance? What are your thoughts on the technology
Well,
side of things?
I was saying earlier, the term digital transformation just makes me roll my eyes. And it makes me roll my eyes because we've been talking now how many years about digital transformation. And I really get frustrated when we have these, terms and we talk, and we actually don't do anything. So and maybe I'm talking about my own organization, but that's fine. When I look at what I think is critical under that umbrella, is that what we have to do is stop talking and take action. And what it has to be is, and I'm going to allude and just re echo some things that I've already said, is that what are our major pain points and how do we address them? For example, at Ortho and now QuidelOrtho, it's critical that we have a seamless foundation of access to our information of our customers. And we've got some technology we've selected, we're implementing, we're moving forward. Check, love it. When we talk about, this concept of we're drowning in data but starving for knowledge. So we're really looking at machine learning and AI and saying, okay, who do we want to partner with and tackle this beast? Right. And we're actually making a decision. So machine learning to me is critically important because what I find in the technical arena and in we're so used to because sometimes went back in the day when I was in the office, hey, what you doing? Hey, I'm digging in the data. I'm digging in the data, right? I'm like, I don't want you digging in the data. I want actionable insights delivered to you so that you can go take care of the customer. And so we've got to reframe that. And as we look at machine learning, AI, and other tools that will give the solution to the person who needs to take action. I always say you need to drive resolution as close to the customer as possible, which means that if I am customer self-serving, I need to have the info in order to resolve the issue. If I'm in LS and I'm dealing with a situation, I too need that information. Field engineer, it doesn't matter who's answering the call of the customer or the customer themselves. We still are looking at, when we look at customer self-serve tools, what is the best platform? I still think we should have an app. That's really the way that I would want to go, a single portal that can be personalized. There's lots of pros and cons, and we've got a hurdle around that. We have no answers. So machine learning is important. Artificial intelligence is important as much as I don't want to admit it. And then how you can, in light of this world we live in, have good virtual support tools. And then what does customer self-serve look like 3, 5, and 10 years out? Will we all be meeting up in some metaverse and diagnosing and walking through the lab? And I look forward to be retired by then, personally. But
I love that you made a comment that I think is so meaningful, and I'm going to borrow it. I promise you that.
Sure.
Drowning in data but starving for
Yeah.
knowledge. Oh my
Yeah.
gosh, I am definitely going to use that. All right, let's move on. In the spirit of time, 5 minutes left. I wish we could keep going. I really do. Linda, we have been so profoundly blessed to have you as a board
Oh,
member, and all the contributions you've made over the years, helping other members, speaking on podcasts prior to your diagnosis and previous to it. You've always just been a tremendous asset for us. So thank you, our secret weapon in many regards.
ah.
What has been valuable from your standpoint of being a board member?
Well, thank you for your kind words. Very generous, John. For me, it's been a joy, and I'll go back to the connection and networking have been invaluable. I have found, and I would say especially over probably the last 2 or 3 organizations that I've worked with, that I have found people be so insular that I actually think it's unhealthy. Do you know what I mean? I find
Yeah.
there's great value to get away from your company and really network outside. And while there's
Yeah.
a place for classical conferences that have more of a like field service conference or contact center, the rich, I'm going to say, dialogue that I find in the Service Council really is a specific niche that has provided value back to me, and it's the quality of the people, and also um, facilitating what really is the latest great, and even some tough topics. You're not afraid of that, and I appreciate that. So I think getting out of your comfort zone, and I've not been shy, and unfortunately, I could not attend this year's service symposium, which is my favorite conference, and a large contingency of my team got to go, which is great. But I would say even more so, and this is foundationally in our relationship, John, I would say the secret sauce of the Service Council is the core philosophy, right? Which has always resonated with me in day one. So when we say service is humanity, recognizing the role, the importance of service, and how we look beyond the metrics, we create really cool, exceptional customer experiences, and that has the power to change the world. And I think that in itself sparks me to just want to be part of it, right? So I
That's
thank you for
awesome.
that. I thank you for the opportunity.
Well, we are so grateful that you are.
Mhm.
And on the comment of, uncommon industries share common pains and pressures and cross-pollinating concepts, I'm down here in a business leadership retreat talking about outside-in approaches. And we previously had Dennis Sedlowski, who's the former CEO of Siemens Energy, talk about this outside-in approach, and great resource on our website. You can learn a little bit more about that. Um, Bob, let's close out the discussion with, all right, set all this critical stuff aside and all the challenges that you've been through. What's a personal passion outside of work, and what's something you're looking forward to? I'd love to hear about what's next for you.
Well, I know Linda could probably guess this, but you know, I really do think laboratory science was my calling, and my passion is bringing quality clinical lab services and medical care to people in need, no matter where they live.
Mhm.
It's not work for me. That I love science, but I also love using my skills to help people that need it. And I very much look forward to getting through this, where I can go back and devote all of my energy into what I love and helping people in Haiti and elsewhere around the world, and put cancer behind me.
Yeah. I do have to jump in and say Bob is an inspiration for me and has been since the first day I met him, and he's an amazing humanitarian. I'm privileged to call him my friend.
Thank you.
Awesome. And Linda, same question for you. What's something personal outside of work and something you're looking forward to?
I would say that the past couple of years, especially after my mom's passing, and I've had a lot of time, reflective time, and I've decided I'm going to take some selfish time. And what I'd like to do is a little bit. I have a sidebar, I'd like to do some more writing and potentially blogging, because I'm really tapping into, there are stories that I feel I need to share. And whether that's just for my own edification, great, whether that's shared. So just really tapping more into the creative side of me. I'm a mediocre ukulele player. I hope when I'm cancer free, I can tell you I'm intermediate or awesome.
I love it.
That's top of mind.
I love it. I love it. That's outstanding. And you are welcome to blog on our Service Council website anytime.
Cool.
So that offer is standing. And I just want to reflect on some comments. You both are amazing and so incredibly brave. And thank you so much for sharing your personal health journeys and all the goodness that was brought forth in today's discussion. And when you both are past all this, we're going to welcome you both back, and we're gonna move this to action. How's that sound?
I would love
Love
that.
it. Love it.
Thank you so much for having us.
Thank you.
You guys are amazing. We are all right behind you, and we look forward to hearing updates as we go forward. So thank you so much for joining today's inService podcast series. My favorite yet, and we'll see you on the next one.
Thank you.